that can all be coded into a program that does the same thing, where you ask questions, drill down, and depending on the basis of the answers, it arrives at some sort of a diagnosis. And that's what expert systems are good for. They were good for diagnostic tasks, like medical diagnoses. Okay, so clinical decision support systems are a latter-day version of the early expert systems. It's a process and a set of tools designed to enhance healthcare-related decision-making through the use of clinical knowledge and patient-specific information to improve healthcare delivery. They do a couple of things. Clinical decision support systems increase the quality of patient care while at the same time cutting costs and preventing errors and adverse events, thus boosting provider and patient satisfaction. There's also such a thing as a computerized provider order entry system, CPOE, which enables physicians to place orders for drugs, for laboratory tests, radiology tests, physical therapy, electronically, with the orders transmitted directly to the respondent. Okay? Here's another relatively recent development that was certainly given more incentive, expedited by the pandemic. Telehealth. And again, I've mentioned this before. My wife is a mental health counselor. She's not a physician, but she does basically the same thing without prescribing medicine. She meets people who have problems and counsels them. And she's been doing it for 25 years, and she's pretty darn good. Well, when the pandemic hit, people got real nervous about sharing air in the same room. And there's no reason why you can't see a doctor on a WebEx meeting. Why not? Unless they have to actually do some sort of physical test that requires them to touch you or put you in some sort of device. And even those can be mediated online. So telehealth, again, electronic information processing and telecommunications to support so-called at-a-distance healthcare, to provide professional and patient health-related training, and to support healthcare administration. So what's the deal here? Well, let's take a look.
Simply, telehealth is the delivery of a health service across a distance. So a good example of telehealth may be if a patient has a video conference appointment from their home or from a regional hospital directly to a specialist at a main city hospital. Telehealth can be also delivered by using the simple telephone, also by sharing information. For example, sending a digital image by email is another good example of telehealth. Often we think of telehealth as a method of supporting people in faraway places. However, telehealth is just as useful for people who live in city environments. Telehealth is not designed to prevent all travel to a specialist. While telehealth can be extremely useful for a range of appointments, such as follow-up appointments, the choice of whether to provide service in person or by telehealth should be based on the clinical requirements and the purpose of the consultation.
Research shows that the assessments and diagnostics performed via telerehabilitation are equivalent to in-person services, and the treatment outcomes that you can achieve via technology are not inferior to traditional services.
Our research debunks this myth by showing that the virtual delivery of healthcare is experienced differently by clinicians than in-person delivery. Importantly, telehealth requires adaptation work and learning of new competencies by clinicians, and changes the dynamics and interaction between those involved in delivering health services.
Well, contrary to what most people expect, older people really do like this form of conversation. Quite apart from the fact that they don't have to travel and get tired going to see the specialist, they find this a really comfortable way of interacting with a health professional.
When you have a well-coordinated service between two sites, then we've found that actually you take less time to manage patients. Patients need less sessions, and the duration of time that you're seeing patients for a session is less. And this actually results in more time efficiencies for the patient and also cost savings for the health service and overall more consumer and clinician satisfaction.
You no longer require expensive hardware to participate in a telehealth consultation. In many cases, a smartphone with a reasonable camera and internet connection can be used for a video consultation or to share clinical information. Of the millions of outpatient appointments being reported throughout major hospitals every year, it's important to consider the potential of telehealth as an alternative method of engaging with patients.
What happened? Oh, this is bad.
This first lesson about telemedicine is going to address what telemedicine is. Defining it is actually rather...
There. Okay. Okay, well, this virtual telehealth raises some problems tied to the use of virtual, such as, what do you do about licensing requirements, right? Must the physicians providing advice to patients at a remote location be licensed to perform medicine in that location? Must the healthcare system be required to possess a license from a state in which it has a virtual facility, such as a video conferencing room? Will the various states require some form of assurance that minimum technological standards, such as the minimum resolution of network transmitted images, are being met? Things of that nature. Okay, that's it for Chapter 8.